Did you know that over 37 million Americans have diabetes, and nearly 1 in 3 doesn't even realize it? If you're over 55, your risk increases dramatically. What if the daily symptoms you're brushing off as normal aging are actually your body's urgent warning signals? Millions of people are walking around with dangerously high blood sugar levels, completely unaware that their bodies are crying out for help. Diabetes whispers through subtle signs that most people dismiss as just getting older. By the time most people receive their diabetes diagnosis, the condition has already been silently damaging their hearts, kidneys, nerves, and blood vessels for years. The good news: your body has been trying to warn you all along. Why do some people in their 60s and 70s maintain perfect blood sugar while others struggle with this condition? What are the 13 warning signs that appear months or even years before a diabetes diagnosis? And most importantly, what can you do starting today to protect yourself, even if you've been ignoring these signals for months? Stay with me until the end to discover the answers to these life-changing questions that could add years to your life and life to your years. Before we begin, please subscribe to our channel and ring that notification bell. Tell us in the comments where you're watching from today. We'd love to get to know our community better. Let me explain diabetes in the simplest terms possible. Think of your body like a house with many rooms, and each room needs energy to function properly. That energy comes from sugar or glucose that travels through your bloodstream like electricity through wires. Now imagine insulin as the key that unlocks each room's door, allowing the sugar to enter and power everything inside. In diabetes, either your body doesn't make enough keys, or the keys don't work properly anymore. This means sugar builds up in your hallways or bloodstream instead of getting into the rooms where it's needed. Over time, this backup of sugar damages your body's wiring system, affecting your heart, kidneys, eyes, and nerves. The condition typically develops gradually, which is why many people don't notice the early warning signs. However, your body is remarkably intelligent and will send you clear signals long before serious damage occurs. Now, let me share with you the 13 crucial warning signs that your body may be developing diabetes. Recognizing these signs early could literally save your life and prevent years of health complications. Warning sign number 1. Excessive thirst and frequent urination, especially during the night. When your blood sugar levels rise above normal, your kidneys work overtime trying to filter out the excess glucose. They start pulling water from your tissues to help flush out the sugar, which makes you feel constantly thirsty. You might find yourself drinking glass after glass of water but never feeling satisfied. At the same time, all that extra fluid has to go somewhere, so you'll notice you're urinating much more frequently than usual. This is especially noticeable at night when you might wake up multiple times to use the bathroom. Many people over 55 assume this is just normal aging, but it could be your body's first cry for help. If you're drinking significantly more water than usual and still feeling thirsty, pay attention. Warning sign number 2. Unexplained weight loss despite eating normally or even more than usual. This might sound like a good thing, but unexpected weight loss can be a serious red flag. When your cells can't access the glucose they need for energy because insulin isn't working properly, your body starts breaking down muscle tissue and fat stores to fuel itself. You might notice your clothes fitting more loosely, or friends commenting that you've lost weight, even though you haven't been trying to diet or exercise more. This type of weight loss often happens gradually over several months, making it easy to overlook. If you've lost more than 10 pounds without trying, especially if you're still eating your regular meals, this deserves immediate medical attention. Warning sign number 3. Persistent fatigue and weakness that doesn't improve with rest. We all feel tired sometimes, especially as we get older, but diabetes-related fatigue is different. It's the kind of exhaustion that makes simple tasks feel overwhelming. You might feel like you're running on empty, even after a full night's sleep. This happens because your cells aren't getting the glucose they need to produce energy efficiently. Imagine trying to start your car with a nearly dead battery. It might turn over, but it won't run smoothly. That's what's happening to your body's energy production system. You might find yourself needing naps during the day, feeling mentally foggy, or struggling to complete activities that used to be easy for you. This isn't the normal tiredness that comes with a busy day or poor sleep. It's a deep, persistent exhaustion that affects your quality of life. If you've been feeling unusually tired for several weeks and rest doesn't seem to help, your blood sugar levels might be the culprit. Warning sign number 4, blurred vision or changes in your eyesight. Your eyes are incredibly sensitive to changes in your blood sugar levels. When glucose levels are high, it causes the lens in your eye to swell, changing its shape and affecting your ability to focus clearly. You might notice that your vision seems worse at certain times of day, or that you're having trouble reading small print that was never a problem before. Some people report seeing halos around lights or having difficulty with night vision. This is different from age-related vision changes, which typically develop very slowly over years. High blood sugar can also damage the tiny blood vessels in your retina, which can lead to serious vision problems if left untreated. Don't assume that vision changes are just a normal part of getting older, especially if they've developed recently. Warning sign number 5, slow healing of cuts, bruises, and minor injuries. Have you noticed that small cuts or scrapes seem to take forever to heal lately? High blood sugar acts like sandpaper in your bloodstream, damaging the walls of your blood vessels and reducing circulation throughout your body. Poor circulation means that nutrients and oxygen can't reach injured areas effectively, slowing down your body's natural healing process. Additionally, high glucose levels can interfere with your white blood cells' ability to fight infection and promote healing. You might notice that a small cut on your finger that should heal in a few days instead takes weeks to close completely. Bruises might linger longer than they used to, appearing darker and taking longer to fade. Even minor scrapes or scratches might become red, swollen, or infected more easily than before. This is particularly dangerous for people over 55 because any break in the skin becomes a potential entry point for bacteria. If you've noticed that your body isn't bouncing back from minor injuries the way it used to, your blood sugar levels might be interfering with your natural healing abilities. Warning sign number 6, tingling, numbness, or burning sensations in your hands and feet. This condition, called diabetic neuropathy, happens when high blood sugar levels damage the small blood vessels that supply your nerves with nutrients. The nerves in your feet and hands are the longest in your body, making them particularly vulnerable to this type of damage. Initially, you might notice a mild tingling sensation, like pins and needles in your toes or fingertips. This might occur occasionally at first, perhaps after sitting in one position for too long. However, as the condition progresses, the sensations can become more constant and uncomfortable. Some people describe it as feeling like they're wearing thick socks or gloves all the time, making it difficult to feel textures or temperatures accurately. Others experience burning pain, especially at night, that can interfere with sleep. You might also notice weakness in your hands, making it difficult to open jars or hold onto objects securely. The danger of neuropathy extends beyond discomfort. When you can't feel your feet properly, you're at risk of injuring yourself without realizing it, leading to infections or other serious complications. Warning sign number 7, increased hunger despite eating regular or large meals. How can your body be starving when you're eating plenty of food? When your cells can't access glucose effectively, they send hunger signals to your brain, telling you to eat more. You might find yourself feeling hungry shortly after finishing a meal, or craving foods you don't normally want, especially sweet or starchy foods. Your body is essentially trying to solve the energy problem by bringing in more fuel, not realizing that the issue isn't the amount of food you're eating, but rather your body's ability to use it properly. This can lead to a frustrating cycle where you eat more but still feel unsatisfied. If you've noticed persistent hunger that doesn't seem related to how much you're eating, it could be a sign that your body isn't processing food efficiently. Warning sign number 8, dark patches of skin, particularly around your neck, armpits, or groin area. This condition is called acanthosis nigricans, and while the name might sound complicated, the appearance is quite distinctive. These patches look like dark, velvety areas of skin that might feel slightly thicker than the surrounding skin. They're not painful or itchy, but they can be concerning cosmetically. These dark patches develop because of insulin resistance, a condition where your body produces insulin but can't use it effectively. The excess insulin in your bloodstream stimulates skin cell growth, particularly in areas where skin folds or rubs together. Many people assume these patches are just dirt that won't wash off, but no amount of scrubbing will remove them because they're actually changes in the skin itself. While acanthosis nigricans can occur in people without diabetes, particularly those who are overweight, it's often one of the earliest visible signs of developing diabetes. The patches typically appear gradually over months or years and are more common in people over 50. If you've noticed these dark areas on your skin, especially if they've appeared recently, it's worth having your blood sugar levels checked. Warning sign number 9. Frequent infections, particularly urinary tract infections, yeast infections, or skin infections. High blood sugar creates the perfect environment for bacteria and fungi to multiply. When there's excess sugar in your blood and tissues, it's like leaving food out for harmful bacteria and yeast. Your immune system also becomes less effective at fighting off infections when blood sugar levels are consistently high. You might notice that you're getting urinary tract infections more frequently, or that yeast infections keep recurring despite treatment. Skin infections might become more common, particularly around areas where moisture can accumulate. Cuts or scrapes that become infected easily can all be signs that your blood sugar is affecting your body's ability to defend itself. Warning sign number 10. Mood changes, irritability, and difficulty concentrating. Your brain relies heavily on a steady supply of glucose to function properly. When blood sugar levels fluctuate dramatically, it affects your brain chemistry and can significantly impact your mood and cognitive function. You might notice that you feel irritable or anxious more often than usual, particularly when you're hungry. Some people describe feeling emotionally on edge or feeling overwhelmed by situations that wouldn't normally bother them. Concentration can become difficult, making it hard to follow conversations, remember appointments, or complete tasks that require mental focus. You might find yourself reading the same paragraph multiple times or forgetting what you were doing. These cognitive changes can be particularly concerning for people over 55 thus, but blood sugar fluctuations can cause similar symptoms that improve once glucose levels are stabilized. Warning sign number 11. Dry mouth and persistent itching all over your body. When your blood sugar is high, your body pulls water from your tissues to help dilute the glucose in your bloodstream. This leaves your mouth feeling constantly dry and sticky, no matter how much water you drink. Your saliva production decreases, which can lead to an increased risk of dental problems. You might notice that your mouth feels like it's full of cotton, or that you wake up at night with an extremely dry mouth. The persistent itching happens because high glucose levels cause inflammation throughout your body and can damage nerve endings in your skin. The itching is typically all over your body rather than localized to one area, and it doesn't seem to be related to any rash. You might find yourself scratching unconsciously throughout the day or waking up at night because of the itching sensation. This isn't the same as dry skin from cold weather or aging. Warning sign number 12. Digestive problems including nausea, stomach pain, or bloating. This is potentially the most dangerous warning sign because it can indicate a serious diabetes complication called gastroparesis or diabetic ketoacidosis. Gastroparesis occurs when high blood sugar damages the nerves that control your stomach muscles, slowing down the movement of food through your digestive system. Food sits in your stomach longer than it should, causing nausea, bloating, and stomach pain. You might feel full after eating only a small amount of food or experience heartburn more frequently. Some people notice that they feel nauseous in the morning or after meals. In more serious cases, these symptoms can indicate diabetic ketoacidosis, a life-threatening condition. Warning signs of this emergency include persistent nausea and vomiting, severe stomach pain, fruity-smelling breath, and rapid breathing. If you experience severe digestive symptoms, along with any of the other warning signs we've discussed, seek medical attention immediately. Warning sign number 13. Swelling in your feet, ankles, or legs, along with poor circulation. Diabetes affects your blood vessels, making them less flexible and reducing circulation throughout your body. Your feet and legs are particularly vulnerable because they're farthest from your heart. You might notice that your shoes feel tighter than usual, or that pressing on your ankle leaves an indentation that takes a while to disappear. Your feet might feel cold more often, even when wearing warm socks. Some people report that their feet or legs feel heavy or achy, particularly at the end of the day. The skin on your lower legs might become shiny, thin, or discolored. These circulation problems are serious because they can lead to infections, ulcers, or in severe cases, the need for amputation. Poor circulation also means that your feet may lose some sensation, making it difficult to notice injuries early. If you've noticed persistent swelling, color changes, or unusual sensations in your feet and legs, especially combined with any of the other warning signs, it's crucial to have your blood sugar levels checked. Now that you understand these 13 warning signs, let's talk about what you can do if you recognize any of these symptoms. First, don't panic. Recognizing these signs early gives you a tremendous advantage in managing your health effectively. Schedule an appointment with your healthcare provider as soon as possible. Be prepared to describe your symptoms clearly, including when they started and how often they occur. Ask your doctor to perform a comprehensive diabetes screening, which includes a fasting glucose test and an A1C test that measures your average blood sugar over the past 2 to 3 months. In the meantime, you can start making gentle lifestyle modifications. Begin with small changes like taking a short walk after meals, which can help your body use glucose more effectively. Consider reducing your intake of sugary drinks and processed foods, but don't make drastic changes without professional guidance. Focus on eating regular meals with a balance of protein, healthy fats, and complex carbohydrates. It's important to understand that some people may not be suitable candidates for certain diabetes management approaches. If you have advanced kidney disease, severe heart conditions, or take blood thinners, insulin, or heart medications, you should never make dietary changes or start new supplements without consulting your healthcare provider first. Some natural remedies can interact with prescription medications, potentially causing dangerous changes in blood sugar or blood pressure. This educational content is designed to help you recognize potential warning signs and have informed conversations with your healthcare provider. It's not intended to replace professional medical advice, diagnosis, or treatment. Always consult with your doctor before making any changes to your medications or treatment plan. Thank you for taking the time to learn about these important warning signs that could potentially save your life or the life of someone you care about. Your health journey is unique, and recognizing these signals early puts you in control of your future well-being. If this information helped you, please give this video a thumbs up and share it with your friends and family members who might benefit from learning about these warning signs. Your share could literally save someone's life by helping them recognize symptoms they've been ignoring. We'd love to hear from you in the comments. Have you experienced any of these warning signs? What questions do you have about diabetes prevention or management? Your experiences could help other viewers in our community. You'll notice we have 2 videos on your screen now. I'm confident you'll find value in continuing to watch more content like this that focuses on your health and well-being. Take care of yourself, and remember that it's never too late to take positive steps toward better health.